Morning everyone, Dr. Zach Long, ICE faculty in the Clinical Management of the Fitness Athlete Division. Welcome to Fitness Athlete Friday here on the ICE Daily Show. Very excited to talk to y'all today. We're going to be talking a little bit about deadlifts for low back pain and 3 research studies that have used deadlifts as part of rehab programs for patients dealing with low back pain. Before we start talking about that, let's mention a couple courses. First up, April 7th and 8th, you really want to head to Las Vegas, Nevada. The ICE Sampler. We're going to have over 9 faculty members there teaching on their area of expertise. It's going to be a weekend full of tons of fun, lots of learning from some of the top clinicians that we have within the Institute for Clinical Excellence. Coming up next weekend, 8 days from now, we've got 2 courses coming up. First, Jeff Moore is going to be down in Orlando, Florida. He's going to be doing his cervical spine management course there. And then in Columbia, South Carolina, we've got myself, Dr. Mitch Babcock, and Ryan Michael Smith all getting together, all the faculty for the Clinical Management of the Fitness Athlete Division, together for one live course in Columbia, South Carolina. Again, those 2 courses are March 10th and 11th. You'll definitely want to check those out. So deadlifts for low back pain. Obviously, we have all had patients that injured their back with deadlifts. We've all had patients come to us who have seen a doctor, another physical therapist, a chiropractor who told them that they should not deadlift or never deadlift again due to their back pain, or have told them that deadlifts are bad for their long-term back health. And hopefully at this point, most of us agree that for healthy spines, deadlifts are not a dangerous exercise to do. And that's something we preach a lot throughout the entire ICE curriculum. If you go to Justin Dunaway's Total Spine Thrust course, he'll tell you do a lumbar spine manipulation, do a thrust manipulation, have somebody stand up, pick up something heavy from the ground, lift it up. Something we preach throughout the continuum of care is that we need to build up people's confidence in movement as a whole. So if we're already good with the fact that deadlifts are good for a healthy low back, what do we get when we're dealing with people with back pain? Well, we're going to talk about 3 studies today from 2015 that looked at taking people with low back pain and having them do deadlifts. The first study was done by Welch et al. In 2015, and they basically put these patients with low back pain into what looks a lot like a sports or strength and conditioning program. They were doing deadlifts, they were doing goblet squats, split squats, planks, etc. Looks like a high intensity strength and conditioning program. And they loaded these patients with low back pain with significantly heavy weights. They had them lifting anywhere from their 6 rep max to their 10 rep max. Now, if we're to look at what's happening in most physical therapy clinics across the country, almost nobody is approaching those strength values in their patients. Nobody's actually loading their patients to that level that are going to actually create true strength changes. So a pretty interesting study to look at there. So what did they find when they put these patients with low back pain through the strength and conditioning program? Well, they had decreased fatty acid or fatty infiltrate into their lumbar spine musculature. Something that we see with a lot of people with low back pain is that they end up getting some fat put into the muscle so that they don't have as much actual muscle mass down there. We also had a 76% decrease in their disability ratings, 72% decrease in their pain, and significant improvements in quality of life outcome measurements. So that study looked at a general strength and conditioning program with heavy loading that incorporated deadlifts. The next 2 studies looked a lot more specifically at the deadlift movement as a whole. ASA 2015, I may have pronounced that wrong, then did a study where they looked at low load motor control drills compared to deadlifts. So the deadlift group basically were taught what we consider a proper deadlift technique, working on a neutral spine alignment. If they couldn't maintain neutral spine alignment, they raised the bar off the ground a little bit. And importantly, they also addressed patients' beliefs about their pain drivers. So they did a little bit of biopsychosocial intervention there as well. That's what the deadlift group got. The low load motor control group got that biopsychosocial component as well. But then the low load interventions that they were given were done specifically to match the tasks, movements, and positions that cause their pain. So their intervention was a little bit more specific to what their pain drivers were. So what did they see with that? Both groups had significant decreases in pain. Both groups had significant let me hit my notes here because I don't want to forget this, they had the same increases in strength and increases in endurance. So really good, both groups saw those increases. The low load motor control group did see a better effect on their patient-specific functional scale, which if you kind of look at the methods of the study where they were given interventions specific to the activities that they were saying were the most bothersome, you would kind of expect that maybe they would do a little bit better there. To me, when I look at that study, I say, well, what would happen if we combine these low load exercises and we did some interventions specific to their drivers of pain and combine that with deadlifts? That's where my mind goes with that. Then that study, that group of authors actually followed that up in a second study. So they took the same data and they took the deadlift group and they looked at, in that deadlift group, can we determine from that data what patients are most likely to respond from a rehab program that includes deadlifts? And they found two things. If patients had a pain visual analog scale score of less than 60 millimeters and their Byring-Sorensen test was greater than 60 seconds, that's a test for lumbar spine musculature endurance. So if they had lower levels of pain, more lumbar spine endurance, then those patients were more likely to respond to a deadlift rehab program than those that didn't match that criteria. So that's some really good data for us to think in our clinic of who might respond from doing more deadlifts. So 3 really cool studies that basically are going to help us out and reinforce what many of us that follow the ICE way know, that deadlifts aren't bad for low back pain, and that actually they can be something good that can reassure patients that their body's adaptable and resilient. And if you get somebody in your clinic deadlifting 100 pounds or 200 or 300 pounds and they were previously having pain picking up their 15-pound child, you've done a lot to build their confidence that their body's not so fragile to do that. And we're going to really word that in a lot of ways within the ICE community, that's not going to be so much around the structure of needing to get specific muscles stronger or get certain positions stronger, but we're going to reinforce that your body is resilient, that your body can heal and adapt, and then put you in positions in the clinic where we can build up your confidence with movement. Now, I just published an article on my personal website, thebarbellphysio.com, where I outlined these 3 studies, and I gave a few tips that I look at and tricks that I look at in the clinic that often key me into why somebody gets low back pain when they deadlift. And we talk about this a lot more in our ICE Clinical Management of Fitness Athlete courses. But you can check that article out at thebarbellphysio.com. But it did spur up a lot of great discussion that you can find from a lot of people, a lot of clinicians that are just really concerned that we're sitting here with this article or in the Clinical Management of Fitness Athlete division and trying to tell you that everybody should deadlift. And clearly, in that last study that I mentioned, we're not saying that everybody should deadlift. We're just saying that this absolutely should be a tool that every physical therapist who treats low back pain, they should have the ability to look at people's deadlifts, analyze their deadlift, and prescribe deadlifts as part of a rehab program when that is appropriate for specific patients. It's not going to be appropriate for everybody, but for a lot of people, it's going to be a good tool. And if that's a tool you don't have in your toolbox, I'd really recommend you looking at incorporating that. Getting some kettlebells in the clinic or some barbells in the clinic. Maybe if you don't personally know how to deadlift, spend some time going out and finding a local strength conditioning professional that's proficient with the deadlift and other barbell, kettlebell movements, and have them teach you. You'll be surprised when you spend time with quality strength and conditioning coaches with how much they can teach you about analyzing movement as a whole, and how much being able to analyze somebody's deadlift will translate to your ability to watch them as they do a vertical jump, as they run, etc. So really want to encourage you to take a look at that sort of stuff. And we obviously cover that a lot in the Clinical Management of the Fitness Athlete division. So thanks for tuning in today. Hope you have a great Friday. Be sure to check out the ICE Sampler April 7th and 8th in Las Vegas, and then March 10th and 11th, Jeff Moore's down in Orlando, Florida for cervical spine management course, and myself, Dr. Ryan Michael Smith and Dr. Mitch Babcock are going to be in Columbia, South Carolina for our Live Essentials course for the Clinical Management of the Fitness Athlete. Have a great day.